Welcome to the hustle and bustle of a morning market in Madagascar and to what is a very special health show on malaria this week. We're in Moronsetra, a dusty village in the northeast of the country. Here malaria is rife the whole year round, but peaks during the rainy season when as many as 500 people a day seek treatment. We're here to understand why this mosquito-transmitted disease refuses to be swept out. Coming up in this week's show, 2 different types of drugs, 2 very different outcomes. Why are mosquitoes developing resistance to the older, cheaper forms of medicines, and why are the locals still using them? Next, failed prevention. Mosquito nets are the World Health Organisation's primary measure against the spread of malaria, but in this town, like many others, they're not always being used as planned. And finally, a look at efforts to fight the disease using toxic sugar baits. Scientists in Israel think they've developed a chemical that attracts and kills malaria-carrying pests. There's various drugs to treat malaria, some much better than others. Here in the middle of the village at this unassuming store, I can buy the medicine on the black market. Here in this store, anti-malarial medication costs less than €1, but chances are it won't work. In fact, doctors here tell us that these cheap and accessible drugs are doing more harm than good.
Whether they're infected or not, at this hospital in Moronsetra, all patients receive medication to fight malaria. In every drip, there's a dose of quinine, an anti-malarial drug. Raswamino needs the treatment more than the others. She's been diagnosed positive several times.
The first time I was suffering with malaria, I was very weak. I couldn't stand up. And afterwards I fainted.
Malaria spreads when an infected mosquito bites a human. The parasite heads directly to the liver and begins to rapidly multiply. From there, it enters the bloodstream, where it waits for another mosquito to carry it to a new host. In just a few days, Raswamino's condition has significantly improved. But she's not yet in the clear. A doctor needs to confirm the parasites have completely disappeared.
For a thick blood smear like this, you have to wait 15 minutes. If you have a fan.
Dr. Timazawa, it seems, is well equipped. In exactly 15 minutes, he's ready to observe the results.
There's no malaria parasites now. Perhaps the treatment worked.
The doctor is cautiously optimistic. These tests are not always reliable. Results can be distorted when patients take drugs without a prescription.
People take anti-malarial drugs in whatever way they can, and it's only after 2 or 3 days when the fever persists that they come to see the doctor. But by then it's too late, and we can't detect the parasites in the peripheral blood. They've already moved into the organs.
As head of the town's official pharmacy, Linda knows the problem well. During the rainy season, she can see as many as 500 malaria patients in a day. All are seeking the same thing, cheap drugs to treat the disease.
People have begun building up resistance to chloroquine and nivaquine because they take them as much as they want, as often as they want.
When these drugs are taken in isolation, resistant parasites survive. The most deadly form of malaria can resist chloroquine in 20% of cases. Other popular treatments are following suit. Today, medical experts recommend a combination therapy based on 2 different artemisinin-based drugs. Cortem is one of the best, and while it's highly effective, it also comes at a high price.
Cortem costs 22,000 ariary, whereas the other drugs are 400 a sheet. It's too expensive. The people here can't afford it.
In Madagascar and in 7 other African countries, pilot project is underway to make these combination drugs more affordable and accessible to the people who are most in need.
Malaria prevention is of course the ideal. The mosquito nets are at the front line of efforts to control the disease. Very quickly you realise just how important they are here. So much so that each house is marked with the letters MID if they've proven they have one. But as we've found out, just owning a mosquito net doesn't always mean it's being used the right way. Malagasy men and women are out early in Maransetra's bay. Here they're using their mosquito nets in a role less focused on fighting malaria and more concerned with catching fish.
The state doesn't allow it, but we don't have any other option. We have no food, so we're forced to break the law.
It's illegal to use mosquito nets in the sea. The fine mesh catches undersized fish, destroying future supplies. But an extra net in the water also means one less being used in a home. A major problem in a country where fewer than half of all children sleep under mosquito protection each night. The local hospital is responsible for providing nets treated with insecticide, hailed by the World Health Organization as the best method of prevention.
We distribute these to pregnant women and children under the age of 5 as a matter of routine.
Most of the nets here have been donated. They cost the equivalent of €6 to buy, a hefty investment considering more than 80% of the population lives on little more than €1 per day. At the maternity ward, the new mothers are constantly reminded of the risks of contracting malaria. Infants who have not yet developed immunity against the disease are far more likely to die as a result.
It's sad. A baby's temperature rises to 40 degrees very quickly. So the mothers are afraid.
This young mother has 2 reasons to be concerned. A set of twins only 1 week old. She says she understands the dangers. She knows what she has to do.
Yes, we will use the mosquito net. It's not so difficult to set up.
Back at the beach, the Coast Patrol have arrived. They've caught some rogue fishermen red-handed.
What is your name? He'll be fined. He's going to be punished.
The authorities take photographic evidence before helping the fishermen and their illegal net back into the sea. They've decided not to confiscate it this time. Either way, it's another mosquito net lost to a non-malaria related cause. Efforts to fight malaria often focus on humans. What can we do differently? How can we develop new treatments? But scientists in Israel are trying a different approach. They're targeting the mosquitoes directly, trying to eradicate them using a lethal cocktail which smells like fruit.
Israeli scientists have taken a new tack in the fight against malaria. They've come up with a cocktail of fruit nectar, sugar and boric acid designed to attract and kill mosquitoes, the attractive toxic sugar bait method. After just 1 application, researchers found mosquito populations declined by up to 90% in a month. But there was one catch. It had to be around isolated water sources, so the mosquitoes couldn't migrate elsewhere.
Our method is limited, at least for the time being, to semi-desert areas, and there it will be very effective. I don't know whether it will eliminate malaria or not, but it will have a drastic effect on the numbers of mosquitoes.
By killing off the mosquitoes where they live and breed, it drastically reduces the chances of malaria spreading to vulnerable villages. And the best part is, it's cheap.
ATSB has several advantages, which means to begin with, it's not applied on vast areas. It's applied in patches or in bait stations, so that the cost of material that have to be spent is relatively low.
With ATSB specifically targeting malaria-carrying mosquitoes, other insects vital for the ecosystem are left alone, and the question now seems to be when, not if, it'll go into full production.
Finally, this week's Strange But True is for anyone who attracts mosquitoes, malaria infected or not. Health campaigners have partnered with computer experts to develop a mobile application that repels the insects using sound instead of spray. The application emits 3 different high-pitched frequencies that serve as a deterrent for mosquitoes. The pitch of the sound is so high most humans won't notice it. I'm afraid we've been using it this week and we're still not sure whether it works. But either way, that brings us to the end of Health This Week. We farewell Madagascar and look forward to seeing you next week.